CLL14 is a phase III randomized trial that was conducted by the German CLL study group. And in this trial, patients with previously untreated CLL and coexisting conditions were randomized to either receive fixed duration of chlorambucil obinutuzumab over 12 cycles, so 6 cycles of obinutuzumab, a CD20 antibody, together with overall 12 cycles of chlorambucil, an oral mild chemotherapy. And this was compared and randomized with Venetoclax obinutuzumab. So again, 6 cycles of obinutuzumab together with overall 12 cycles of Venetoclax, which is an oral BCL2 inhibitor. And the primary endpoint of this study was the progression-free survival. And we have previously published the primary analysis of this study last year, where it was shown that there is a significant PFS benefit for patients who received a fixed duration of Venetoclax obinutuzumab. And with the analysis that we now present at this meeting, we wanted to see how do patients perform in the long run, how many patients maintain their deep responses after completing therapy, and we also wanted to see how the safety and overall toxicity of the regimen is once patients have been off treatment. So the first main finding of this study was, or of this follow-up, was that patients overall do maintain their PFS benefit after Venetoclax obinutuzumab. So we have a 3-year PFS rate of approximately 82% in patients who have received Venetoclax obinutuzumab, and this was compared to chlorambucil obinutuzumab, where we had a PFS at 3 years of approximately 50%. So we see that the PFS benefit is maintained, and we also see that in the long run, as we are measuring the levels of minimal residual disease in the ongoing follow-up, we see that approximately half of the patients who have been treated with Venetoclax obinutuzumab still are with undetectable MRD levels, which is compared to chlorambucil obinutuzumab, where we only see 7% of the patients having still undetectable MRD levels. So we see that there is also a difference in the maintenance of the deep response levels. We also see that those patients who lose their MRD negativity, so to speak, they mostly just have an increase to low MRD levels. So most patients still do not develop disease progression. We have overall only 21 disease progressions in the Venetoclax obinutuzumab arm, and of those, only 9 required actual next line of treatment. So we do see that patients now that have been off treatment for over 2 years now, that the majority of them still does not require a next line of therapy. So we also have a clinically meaningful period of a treatment-free duration. We also looked at safety, and we did not observe any significant long-term toxicity, particularly because the number of adverse events naturally drops once patients are off treatment. So again, we do see that there is an advantage of having a fixed duration approach for the patients. We do see a slight increase in the absolute number of second primary malignancies, overall approximately 5 to 6% frequency in the Venetoclax obinutuzumab arm and approximately 3% in the chlorambucil obinutuzumab arm. Mostly solid tumors, so no increase of MDS or AML or things that we usually might see after intense chemomonotherapy. However, this is something that needs to be further followed up. We didn't see a clinically or statistically significant difference between the arms, and we haven't seen any clear pattern there. So this is something that we continue to monitor in the ongoing follow-up of the trial. So overall, we do see that the trial still shows that the fixed duration approach of Venetoclax obinutuzumab is feasible and effective in previously untreated patients, and we are continuing to follow up to understand more about the MRD kinetics in this group of patients and to see the even longer effects of this novel treatment.